Family planning is very important. It goes without saying, but let me give you some reasons why. Firstly, we know that women are becoming more and more economically viable, more economically empowered. They're pursuing higher education and so on. All of these typically can get more complicated if they have children at certain points. So if women are able to plan their families by saying, okay, I want to have a child before my master's program or after my PhD program, it makes it possible for them to get the best of both worlds.
Family planning, it's more than just reducing the number of children or appropriate spacing. It's actually empowering family. It gives power to the family to be able to make informed decisions about their livelihood, about their life. And more importantly for us in the health space is that cost-effective way to lower our unacceptably high maternal and infant mortality.
Additionally, family planning is crucial in the sense that most women get married very early. At least in my part of the country, we all get married very early. So when you get married at 20 to 24, you have another 2 decades of active reproductive life. If you are not able to space your children, you might end up with far more children than you are capable of taking care of economically, physically, or even, psychosocially.
Some of the challenges we had in the space of reproductive health and family planning, majorly one of it is the technical direction in terms of how to go about this activity in a technical way to ensure that we have an improved outcome, and in the aspect of funding as well. Though government is trying their own bit, but in terms of funding, we have a large number of activities in the states that require funding.
Before TCI partnership in the states, we have the challenges of inadequate service provider to provide lack services. Also, we have low service uptake when it comes to demand generation for family planning.
Initially, when we come on board, the major challenge is working together with the family planning providers. They work in silos, but with the coming of TCI, I think we are now working as a team.
Our state partnership with TCI has really helped us. We've really helped us in reducing or improving on our previously identified challenges.
With TCI intervention in the state, we saw that we now have improved access among the women of reproductive age. And what has contributed to this are the high impact interventions. The approach is like a magic because the approach cuts across the thematic areas in family planning. When we talk of service delivery, all the high impact interventions like capacity buildings for providers, enriches activities, site orientations, it has improved the capacities of service provider.
The most significant change that's occurred in the Ministry of Health Sexual and Reproductive Health Unit since we partnered with the Challenge Initiative was in the quality of the data that we were generating. We used to have data, obtained from our facilities and all of that, but there were certain checks put in place, certain capacity building activities that were conducted through that partnership that improved the capacity of our staff and ultimately the data quality.
At the end of the month, we used to embark on the analysis of our indices and thematic health indicators across the facility, where we were able to identify the various gaps and the challenges being in data reporting. As family planning is concerned,
one of the critical changes that occur, particularly with the TCI model and the partnership we had with the Challenge Initiative, is that TCI puts the states on the driver's seats. And more importantly for us is we co-created the solutions.
I'm Aja Balogun. I'm family planning provider, also family planning supervisor for Ilorin East Local Government. I counsel his clients on family planning. I gave family planning services. We distribute family planning commodities like condom. We go out for sensitization in the community. We provide family planning services in this unit. We give injectables. We give long-acting like implants. We give IUD services.
It reduces the abortion rates in Alanamu community.
The TCI has done a lot, like training, as I've said, CM, demand generation, and others.
Ọ̀pọ̀lọpọ̀ àwọn tí à ń polongo fún, tí à ń bá sọ̀rọ̀ nípa ìfètòsọ́mọ bíbí, tí a bá bá wọn sọ̀rọ̀, tí ọ̀rọ̀ wa bá ti yéra wa, a máa ń já referral card fún wa. Látàrí pé kí wọ́n fi lè lọ sí facility láti lọ gba ìfètòsọ́mọ bíbí, ìwé tó bá bá wọn lára mu.
Ìfètòsọ́mọ bíbí ó dáa púpọ̀ jù. Òde tá a rí ń bẹ, àǹfààní tá a rí ń bẹ yẹn ó pọ̀ gan-an. Kí láǹfààní tó wà ń bẹ ni pé lẹ́nu bàtà ti ṣe ìfètòsọ́mọ bíbí ọkàn balẹ̀. Ìgbádùn àlàáfíà wà láàrin ọmọ wa, ó wà láàrin inú ilé wa, àwa náà ń gbádùn ayé.
Ìfètòsọ́mọ bíbí dáa púpọ̀ torí látijọ́ tèmi ti gbà á, mo enjoy ara mi, mo ń gbádùn. Mo rójú mú táwọn ọmọ mi, mo rójú mú tó iṣẹ́ mi. Tí dádì bá ló yá kò sí wàhálà.
Nǹkan tèmi máa ń rò nípa rẹ̀ ní tẹ́lẹ̀ pé ṣé kò ní fún yàn ní pírọ́blẹ́mù pé téèyàn bá ṣe tán àwọn kan sọ pé èèyàn lè má rí ọmọ bímọ wípé dẹ́yìn nǹkan oṣù náà kò ní wá èmi lè má wá dédé ẹ̀rù yẹn máa ń bà mí tẹ́lẹ̀. Àmọ́ látìgbà tọ́lọ̀ ni mo pàdé wọn níbi tán ti ń kiri àwọn tán já pépà káàkiri tí mo ti rẹ́ nìkan tí mo ti gbà tó ti ṣàlàyé fún mi pé kò rí bẹ́ẹ̀ o pé tí n bá ti lọ ṣe tẹ́ẹ̀sì èyí tó bá ti bá mi lára mu kò sí pírọ́blẹ́mù bẹ́ẹ̀ láti gbà àwọn tèmi náà ti ṣe kó sí wàhálà kankan bẹ́ẹ̀.
ti rí pa TCI ní àdúgbò wa yìí oorun àìrò tẹ́lẹ̀ ó ti stop àwọn ọmọ tí wọ́n ń sùn tí ò lọ school yẹn everybody àwọn míì tó yẹ pé wọ́n lóyún tó yẹ pé tó máa ti ń ṣẹ́yún oyún yẹn gbogbo ẹ ti reduce tó ń jẹ́ pé ìfọ̀kànbalẹ̀ ti wọ àdúgbò wa ní ibi báyìí.
Assalamu alaikum wa rahmatulahi wa barakatu. Ìfi ètò sí ọmọ bíbí tí a bá lọ lè wò gẹ́gẹ́ bí situation tí a wà lákòókò tí a wà yìí a rí i pé n tí a ń pè ní ìfètòsọ́mọ bíbí tí ṣẹ̀rí à ń pè ní tansimu nasli ọ̀dà látàrí wípé fún health wa and then láti lè jẹ́ kí àlàáfíà ó jogún láàrin ọkọ àtìyàwó.
Childbearing and family planning is very, very important in a family. I remember there's a passage in the Bible, Luke chapter 14, verse 28 precisely. It says, do you see a man that wants to build a mansion? Such a person must sit down first and plan. So in family planning, as a family, it's very, very important. Child spacing and family planning is very, very important in the family.
There's TCI in Kwara State. They've trained journalists in the state, selected journalists in the state to have more information about family planning, to have more information about misconceptions, against family planning.
TCI has actually supported us in two main areas. One, in capacity building of our, LGMI officers. So as well as the capacity building for these MRO officers of our various health facilities.
First and foremost, let me appreciate the TCI for supporting and implementing some of the HMI activities in the state. And the state has embarked on a kind of a step to ensure that we sustain all these activities that have been existing, such as data validation. So what we do is that we have included all this in our budget line, the State Ministry of Health budget line, so that we'll be able to sustain the activity that has already been existing.
When I mentioned all the benefits of family planning, there's something very crucial. And that's one of the reasons why it's very important for us to sustain family planning interventions in Kwara State. And that is that we want every child in Kwara born to be wanted. Every child born in Kwara, we want that child to be wanted. And now, with the work that TCI has done, particularly in supporting us to increase demand generation, we have more women knowing where to go to get a way to like space their children to their convenience.